We're back, second half of Impact Texas. I'm Jon Griffin. I know nothing about anesthesiology except for the last 15 minutes that I enjoyed with Dr. Stephen Ellis and Dr. Karen Rock. Thanks again for joining us.
Thank you.
You're welcome.
From Metro Anesthesia Consultants, you can go to the website, find out more information about them, metroanesthesia.com. They're frequently asked questions. They may seem like simple questions to an anesthesiologist, but these are the kind of questions that us patients are asking and wondering all the time. You can go on there. You can even click on and see pictures of the anesthesiologists, the wonderful doctors, men and women with Metro Anesthesia Consultants. Right now, you're contracted in 4 hospitals here in DFW.
Correct.
Can you name those?
Medical Center of Louisville, Medical Center of Arlington,
Presbyterian Hospital of Rockwall, and Lake Point Medical Center.
We went into the break. We're not here to bash people. We're not here to bash anybody's profession. But the reality is some hospitals and some practices in the whole health care of our nation are looking at trying to save a little money here and there. What is the big difference between an anesthesiologist and a nurse anesthetist?
Well, first off, let me just say that you were saying that healthcare was trying to save money. Insurance companies and actually the CMS, which is Medicare and Medicaid, pay exactly the same fee to anesthesiologists and CRNAs or nurse anesthetists. So there's no big savings as far as how much we each cost. The big difference, and I'm just going to be factual here. I think that's the simplest way to go. An anesthesiologist is a physician. Okay, so we go through 4 years of undergraduate. We go through 4 years of medical school, and in medical school, obviously, we do all the classes, and then we do our clinical rotations, and we do clinical rotations through various specialties, so that we can learn and study and treat medical conditions. Okay, so that we can actually treat, and that's an important thing there. And then once we're done with our 4 years of medical school, then we undergo a year of internship, whether it be in medicine or surgery, depending on whatever you want to choose. And then you do 3 years of your anesthesia training. So that's what, as a physician in anesthesia, that's what you have to do. So basically, after high school, that's 12 years. A nurse anesthetist, they can go, and there's multiple routes that they can take to become a CRNA. Mm-hmm. They can go and do their associate's degree, and they become an RN, and that's 2 years. They can then go and do a BSN, okay, which is your bachelor's of nursing, and that takes a year, and that can be done in the classroom or online. And then they do, after they've got their BSM, then they go ahead and they have to do 1 year of critical care, whether that be in the ICU, in the emergency room, they have to do a year of critical care. And then, once they're done with that, depending on what program they go to, they can do anywhere from 18 to 36 months of anesthesia training. And not all of that is clinical. Okay, some of it's book work and some of it's clinical. So, their road is, what's that, 3, maybe 6 years of total training. Whereas is, we've got 12 years. So we've got twice the amount of time. Even the shortest, and I'm just talking the difference between them taking the shortest route there and us taking the shortest route there. They can get there in 6 years. We get there in 12 years. So, that's the big difference. There's a big difference in the level of education as far as, treating and recognizing medical conditions. Mm-hmm. And also, as a physician, I practice medicine. A CRNA is a nurse, and therefore, by the letter of the law, cannot practice medicine. So that's from the factual standpoint. And I think that's the simplest way to kind of explain the differences. I don't know if Dr. Rock has...
Dr. Rock, would you say the trend is going for hospitals to employ nurse anesthetists?
It depends on, I think, the hospital that you're working in. It depends on the state that you're living in. So, for example, the 4 hospitals that we work at in the Metroplex, we are an all-physician group. There are no CRNAs. It's MD anesthesiologists only. But it really depends. I think a lot of it is regional and really depends on, the contract that the hospital has.
I know with anesthesiologists, we were talking in the break, that safety is your utmost concern. You can say safety, but the reality is you live safety and the safety of the patient. Very rarely, ever, I cannot ever recall a mistake made by an anesthesiologist which cost somebody their lives. It does happen. But let's talk about the risks and what we as patients absolutely positively need to know and need to be able to answer to our doctors and medical staff and anesthesiologists.
I think one of the most important things is for the patients to be absolutely honest, regardless of, the drugs they have taken, the medications that they're on, if they've had surgery in the past, if they've had problems, what they've had to eat or drink, because we do not allow patients to eat or drink the night before surgery. And that is to prevent them from having a very bad pneumonia called aspiration pneumonia, where if you eat, the contents of your stomach can actually go into your lungs. And even young, healthy people can do very poorly if this happens to them.
Even so much as a sip of water, or as we were talking in the break, a Jolly Rancher or anything.
We will instruct patients, a lot of the times we'll get the medical history. They will be contacted. If they take certain medications, we actually do want them to take the morning of surgery, and they can take it with a small sip of water. Really beyond that, we really don't want you having anything, for 8 hours prior to your procedure. And that often falls before midnight, because a lot of the surgeries we do are very early in the morning. And then even later on in the day, surgery schedules change and things like that, and we may want to move you up. And if you've eaten or had something to drink, it really is a big concern. And we're not being difficult. It's actually very, very detrimental to your health if you do eat or drink.
Dr. Ellis, risk or complications with anesthesia?
Damage to the teeth happens rarely, but it's probably one of the bigger ones that we have to deal with, just because, some patients may come to us who, their anatomy, they may have an overbite, they may have poor dentition, they may have loose teeth or lots of cavities and weak teeth, and so the instrument we use to put the breathing tube in is made of metal. And so if you run into a little bit of difficulty that you weren't expecting getting the breathing tube in, then in my mind the last thing that I'm concerned about is I'd rather save someone's life and get that breathing tube in than have to worry about the teeth. But most of the time it's not an issue. It's only when those surprises kind of pop up, which, hey, that happens in everyday life. Things pop up unexpectedly, right?
And then to be honest, if you have, dentures or things that come out or removable teeth, they really need to come out, because there is a risk of those, potentially going into the esophagus, going into the lungs. It's really not safe to have, anything that's removable in the mouth. Piercings needs to come out. And it's, again, we're not being difficult. It's again, for patient safety.
Dr. Stephen Ellis, Dr. Karen Rock from Metro Anesthesia Consultants, our guest this week. Now, I realize, well, maybe I don't realize. Maybe you were present during my colonoscopy. I'm not sure who my anesthesiologist was, but was I completely out? Because I think I was completely out.
If you had an anesthesiologist taking care of you, yes.
I've talked to some people where they said, I had a colonoscopy and I wasn't completely out.
There's two ways you can go when you have your colonoscopy. You can have an anesthesiologist involved.
Yep, and he was.
Or you can have a nurse involved. And I'm not talking about, this is not a nurse anesthetist. I'm not going that right. This is just what we call the sedation nurse, okay? And for certain, patients, your GI doc may decide, hey, you know what, you can probably tolerate this without an anesthetic. So I'm just going to have the nurse give you some sedation. And, that's a little more likely for the patient to remember some of it. But when you're with us, you're out. There's no
thank you, because I didn't want to remember a thing about my colonoscopy. And let me tell you what, Jeff, it was a joy. It was just a joy. I never knew anything happened down there. There is a website our listeners should know about, doctorbyyourside.org. Tell us about that, Dr. Ellis.
Doctor by Your Side is an organization that has been formed to educate the public on the differences between an anesthesiologist and a nurse anesthetist or a CRNA. That is what that organization was set up for. So we're not actually physically a part of that organization. So it's out there and I think it's a great website. It gives you a lot of information. It does it from a factual point of view. It doesn't try and drag anyone down. It just tells you this is the difference. And so when you go into surgery, you need to realize that sometimes you're going to have a physician putting you to sleep, and sometimes there'll be a nurse there putting you to sleep. And it's just telling the patient, it's educating the patient so that they can make an informed decision. That's what it's there for.
Gotcha. As we close up here, Dr. Rock, what's your favorite medical TV show?
I've gone through the gamut. When I was younger, I enjoyed ER, and certainly in the years where prior to going to medical school, I really enjoyed that. And then it got a little bit too crazy, I would say, maybe unrealistic. And then I did watch Grey's Anatomy for a while, and I'm kind of quiet on I have enough excitement and medical excitement in my career, so I don't watch as many of those shows, but a lot of them are entertaining. I don't think they're necessarily accurate, but entertaining.
Is there any accurate ones out there, Dr. Ellis?
Probably the documentary ones that are on, like Bravo and TLC and what have you, but as far as the TV shows go, no. I mean, for example, House. Okay, half the things he does, you could not get away with.
Yeah,
they're unethical.
Sued.
You would be sued.
Yes.
And that's where most of them, they go down that road, and just for excitement and to keep the viewers tuned in. So to begin with, when I started watching House, I was like, oh, this is a pretty good show. And then it does the same thing as all the other medical shows. They kind of go down this crazy path, and they just try and keep viewers, and so they start doing all this outlandish stuff. So it's entertainment.
Well, I don't think there's any question that the finest daytime show out there is General Hospital, and it's real. I mean, it's all real.
Yes.
It's very realistic.
Yes.
We thank you so much for enlightening us. We all know a little more about anesthesiology today. Thanks for putting up some of my very rudimentary questions. And we thank you for being here on Impact Texas, Dr. Stephen Ellis and Dr. Karen Rock.
Thank you very much.
Thank you very much.
That's your show for the week. If you have any questions or comments, feel free to phone us. Phone number and email address coming up at the close of this program for Dr. Ellis, Dr. Rock, and the 45 physicians involved with Metro Anesthesia Consultants at metroanesthesia.com. I'm Jon Griffin for Impact Texas. Make it a great weekend. We will talk again next weekend.
This has been Impact Texas, a public affairs radio production for Cumulus Radio Dallas-Fort Worth. Got a high-impact interview idea? We want to share your story. Contact Jon Griffin at 214-525-2505. That's 214-525-2505. Or email jon.griffin@cumulus.com. Impact Texas. Weekends at the same time from Cumulus Radio Dallas-Fort Worth.